It's about 1,100 children infected every day, and those less than one a day come from the United States, one a day from Europe, about 100 a day are infected in Asia and the Pacific, and then 1,000 every day are infected in Africa. And so this is where we focus our attention. And yet it's interesting when you start to put things in perspective. When you look at the United States, there are 7,000 pregnancies in HIV-positive women every year in the United States. Rwanda has more. Rwanda has 8,000. And then when you go to South Africa and you go to Baragwanath Hospital in Soweto, outside of Johannesburg, that single hospital has as many as the entire nation of Rwanda and more than the United States. And that's just the tip of the iceberg when you look at what's happening in all of South Africa, where each year 300,000 women with HIV are having babies. Recognizing that nurses are in short supply, we need to create another tier of task shifting so that nurses can pass on jobs to our staff. Remember, our staff are trained for 2 to 3 weeks. They can spend an hour instructing a mother on how to feed her infant. Nurses don't have that kind of time. A nurse has minutes per patient. And so if you leave these jobs with the nurses, patients won't get the education they need. Our staff can spend hours with patients. And so this is how service is best deployed. And if at 10 weeks she still hasn't come back, we go visit her at her home. Now, to appreciate in Africa, Africa has more cell phones than the United States and Canada combined. So this is data from 2009. 358 million cell phones in Africa, 276 million cell phones in North America. What's interesting is, had I talked about doing this 10 years ago, people would have said I was mad. Because the truth is, there weren't cell phones in Africa. But now, people have phones. People are getting connected. And it's incredibly important. People are using an increasing amount of their disposable income on cell phones. And we can start to use cell phones cleverly to improve the quality of patients' care. So, aware of this, ACFU Active Client Follow-Up Group, 84% of the mothers hadn't had their babies tested by 8 weeks and required phone calls. We reached 60% of them by phone calls.